Good day, class. For week 7, we are going to discuss about developing a health education plan. Previous discussions have addressed the unique characteristics and attributes of the learner with respect to learning needs, readiness to learn, and learning styles. Clearly, assessment of the learner is an essential first step in the teaching learning process. Assessment determines what the learner needs to know, when, and under which conditions of the learner is most receptive to learning, and how the learner learns best or prefers to learn. Before a decision can be made about selecting the content to be taught or choosing the teaching methods and instructional materials to be used to change learner behavior, the educator must first decide what the learner is expected to accomplish. Individual needs are determined by identifying gaps in the learner's knowledge, attitudes, or skills. Identification of needs is a prerequisite to formulating behavioral objectives that serve as a roadmap to guide subsequent planning, implementation, and evaluation of teaching and learning. Let's go to the next slide. In this week's topic, we will focus on writing objectives using the revised Bloom's taxonomy and the elements or components of a teaching learning guide. Let's begin. In the 20th century, noted educators and education psychologists developed approaches to writing and classifying behavioral objectives that offered teachers assistance in organizing instructional content for learners functioning at various levels of ability. Major in 1997 has been the primary educator credited with developing a system for writing behavioral objectives that serve to help teachers make appropriate instructional decisions as well as to assist learners in understanding what they need and are expected to know. The underlying principle has been that if one does not know where he or she is going, how will a person know when he or she has arrived? Well, let's go to our learning objectives. These are the things that we need to accomplish for this topic. First, differentiate between the terms goals and objectives. Next, assess opposing viewpoints of using behavioral objectives for teaching and learning. Distinguish among the 3 domains of learning, which are cognitive, affective, and psychomotor. Develop teaching plans that reflect internal consistency between elements. And recognize the role of the learning contract in teaching. Now, class, the taxonomic system devised by Bloom, Engelhard, First, Hill, and Grathwohl in 1956 for categorizing objectives of learning according to a hierarchy of behaviors has been the cornerstone of teaching for over half a century. This concept of taxonomy, that is, the ordering of these behaviors based on their type and complexity, pertains to the level of knowledge to be learned, the kind of behaviors most relevant and attainable for an individual learner or group of learners, and the sequencing of knowledge and experiences for learning from simple to the most complex. Based on the original work from Bloom and his colleagues, Anderson proposed a revision to this initial taxonomy for learning, teaching, and assessing behaviors. The most prominent differences include changing the names in the 6 categories here into and then rearranging the last 2 categories, which are here. The revisions to Bloom's taxonomy have the potential to make explicit teacher assessment, student assessment, as well as teacher and student self-assessments as patterns of use emerge. As you can see here, from the previous taxonomy created by Bloom and his colleagues, you can see that they used nouns for the taxonomies. However, Anderson revised them to become verbs, which are more feasible to do. But as you can see, they have the same concept, except that for the last 2 categories, They were exchanged. Synthesis was placed at the top, while evaluation was placed below synthesis. Skill in preparing and classifying behavioral objectives is a necessary function of the educator's role, whether teaching patients and their families in healthcare settings, teaching staff nurses in in-service and continuing education programs, or teaching nursing students in academic institutions like ours. It is important to clarify the meaning of the terms educational objectives, instructional objectives, and behavioral or learning objectives. Although often used synonymously, these terms can be distinguished from one another. Educational objectives are used to identify the intended outcomes of the education process, whether referring to an aspect of a program or a total program of study that guide the design of curriculum units. Instructional objectives describe the teaching adjectives or activities rather, specific content areas, and resources used to facilitate effective instruction. Behavioral objectives, also referred to as learning objectives, make use of the modifier behavioral or learning to denote that this type of objective is action-oriented rather than content-oriented, learner-centered rather than teacher-centered, and short-term outcome-focused rather than process-focused. Behavioral objectives describe precisely what the learner will be able to do following a learning situation. The terms goal and objectives are often used interchangeably as if they are one and the same. However, a real difference exists between the two terms. This distinction must be clearly understood because it is common to find confusion on the meaning of these terms among nurses and nurse educators alike. Two factors differentiate goals from objectives: their relationship to time and their level of specificity. It is necessary to have both goals and objectives to accomplish something. Goals without objectives cannot be achieved, and objectives without goals will never result in anything meaningful and worthwhile. Objectives must be achieved before the goal can be reached. They must be observable and measurable for the educator to be able to determine whether they have been met by the learner. There are also sub-objectives, which are smaller parts of the objective to lessen or to divide the tasks of the learner. A goal is the final outcome to be achieved at the end of the teaching and learning process. Goals, also commonly referred to as learning outcomes, are global and broad in nature and are long-term targets for both the learner and the teacher. Goals are the desired outcomes of learning that realistically can be achieved, usually in a few days, weeks, or months. They are considered multidimensional in that a number of objectives are subsumed under or incorporated into an overall goal. An example for here is during this 3-week hospital duty at Maria Reina Xavier University Hospital, the student nurses aim to render holistic nursing care to each patient assigned to them, regardless of sex, religion, age, and political affiliations. Let's go to the next slide. An objective, in contrast to a goal, is a specific, single, concrete, one-dimensional behavior. Objectives are short-term and should be achieved at the end of one teaching session or shortly after several teaching sessions. A behavioral objective is the intended result of instruction, not the process or means of instruction itself. Behavioral objectives describe precisely what the learner will be able to do following the instruction. Objectives are statements of specific short-term behaviors. They lead step by step to the more general, overall, long-term goal. According to Major in 1997, an objective describes a performance that learners should be able to exhibit before they're considered competent. Here's an example of a goal or an objective for a nursing student. At the end of 4 hours of nursing care, the patient will be able to A. Report a decrease in the pain scale from 9 to 10 to 3 to 5, and B. Have a decrease in body temperature from 38 degrees Celsius to 37 degrees Celsius or lower. Sub-objectives also may be written and reflect aspects of a main objective. They too are specific statements of short-term behaviors that lead to the achievement of the primary objective. Objectives and sub-objectives specify what the learner will be able to do after being exposed to one or more learning experiences. A sub-objective may be one of the two sub-objectives given here in the example, A and B. Now, objectives can be thought of as advanced organizers, that is, statements that inform the learner of what is expected from a cognitive, affective, or psychomotor perspective prior to meeting the goal, which is the desired end or intended outcome. Objectives are derived from a goal and must be consistent with and related to that goal. Here are Bloom's domains of learning. We have the psychomotor, the cognitive, and the affective. However, in the next following slides under psychomotor, we'll be discussing or using Dave's psychomotor levels of learning. Let's proceed to the next slide. Now class, well-written behavioral objectives give learners very clear statements about what is expected of them or of you. They also assist teachers, us, in being able to measure learner progress toward achieving the objectives. Over the years, Robert Major's approach to writing behavioral objectives has become widely accepted among us educators. His message to them or to us is that for objectives to be meaningful, they must precisely, clearly, and very specifically communicate the teacher's instructional intent. According to Major, the format for writing concise and useful behavioral objectives includes the following 3 important characteristics. Number 1, performance. This describes what the learner is expected to be able to do to demonstrate the kinds of behaviors the teacher will accept as evidence that objectives have been achieved. Activities performed by the learner may be observable and quite visible, such as being able to write or list something, whereas other activities may not be as visible, such as being able to identify or recall something. Number 2, condition. This describes the situations under which the behavior will be observed or the performance will be expected to occur. And finally, criterion. This describes how well, with what accuracy, or within what time frame the learner must be able to perform the behavior so as to be considered competent. Okay, now let's go to the next slide. Now class, behavioral objectives are statements that communicate who will do what under which conditions and how well, how much, or when, according to Cummings in 1994. An easy way to remember the 4 elements that should be in a behavioral objective is to follow the ABC rule proposed by Smaldino, Lowther, and Russell in 2012. A for audience, who. This identifies who will achieve the objective. Example, after completing this unit, students will be able to Okay, that's the audience. Now for B, behavior. What? Use the action verb to describe the observable, measurable behavior that demonstrates mastery of the objective. So what do you want to see in this objective? This answers what? For C, this is the condition which will answer under which circumstance. So you need to state the condition here, if any, under which behavior is to be performed. Example, with a calculator, using a CPR mannequin, using an ECG machine. Okay, now let's go to the D, which is degree. This is to answer how well, to what extent, within what time frame. Now this needs to specify the criterion where possible, for example, for acceptable performance. Example, in 25 or fewer words, within 4 minutes, within or after 30 minutes. It should describe the time frame. Okay, so I'll let you look at the screen for a while to memorize our ABCD rule. Okay, let's move on to the next slide. Now, our objectives should be also SMART. It should be specific. You should know what is expected of you to do or perform and how you will be assessed. You need to make sure your goals are specific and narrow for more effective planning. They should be measurable for M. Your performance can be tested whether you have acted upon the expectation or not. This defines what evidence will prove that you're making progress and re-evaluate when necessary. For A, attainable, you have to see if the expected behavior can be performed by the audience or they're capable of doing it. You have to make sure you can reasonably accomplish your goal within a certain time frame. For R, relevance, you have to see if the expected behaviors all align well with the goal, or else the audience will get lost. So your goal should align with your values and long-term objectives. For the T, timely in the book or time-based, you should be able to indicate a deadline or time frame in which the expectations must be achieved. It should be realistic, somehow ambitious, end date for task prioritization and motivation. Okay, so you need to make your objectives SMART, specific, measurable, attainable, relevant, and timely or time-based. Right, let's go to the next slide. A taxonomy is a way to categorize things according to how they are related to one another. Bloom and his colleagues, and Krathwohl and Maja developed a very useful taxonomy known as the Taxonomy of Educational Objectives as a tool for classifying behavioral objectives. This taxonomy is divided into 3 broad categories or domains. We have the cognitive or thinking domain, affective, feeling domain, and psychomotor, doing or skills domain. Although these 3 domains of cognitive, affective, and psychomotor learning are described as existing as separate entities, they are interdependent and can be experienced simultaneously. Let's take a look at them one by one. The cognitive domain is known as the thinking domain. Learning in this domain involves acquiring information and addressing the development of the learner's intellectual abilities, mental capacities, understanding, and thinking processes. Objectives in this domain are divided into 6 levels, each specifying cognitive processes ranging from the simple, knowledge, to the more complex, which is evaluation. But in the revised taxonomy, it's the create, which is at the last or at the highest phase or level of the taxonomy. Knowledge. So this is the ability to recall facts and previously learned materials. So some examples of verbs being used for objectives with regards to how to assess knowledge are the following: list, define, tell, identify, show, label, collect, examine, tabulate, quote, and name. I will give you 5 seconds to browse through these words. Okay, let's go to the next. For the comprehension or remembering, this is the ability to grasp meaning of learning material. Some of the words being used for us to assess how a person remembers are the following: summarize, describe, interpret, contrast, predict, associate, distinguish, estimate, discuss. I will give you 5 seconds to skim through these words. Okay, let's go to the next slide. For applying or application, this involves the ability to use unlearned material in new and concrete situations. Some of the words being used to apply are the following: apply, demonstrate, calculate, complete, illustrate, show, solve, examine, modify, relate, change. I will give you 5 seconds to skim through these words again. Okay, let's go to the next level. Analyzing or analysis. This involves the ability to break down material into its component parts for organization. Some of the words being used here are analyze, separate, order, explain, connect, classify, arrange, divide, compare, select, explain, and infer. I will give you 5 seconds to read through these words again. Okay, let's go to the next slide. For the synthesizing or create, which is actually the last level in the revised Bloom's taxonomy according to Anderson, this is the ability to put parts together to form a new whole. The words being used for this level are the following: combine, integrate, modify, rearrange, substitute, plan, create, design, invent, compose. I will give you 5 seconds to read these words again. Okay, let's go to the next slide. The evaluation level is actually the last part of the old Bloom's taxonomy, but in the revised Bloom's taxonomy, it's at the 5th level. This involves the ability to judge the value of material for a given purpose. Now, the words being used for evaluation or evaluate are the following: assess, decide, rank, grade, test, measure, recommend, convince, select, judge, explain, and discriminate. I will give you another 5 seconds to read through these words again. All right, let's move on to the next domain. The affective domain is known as the feeling domain. Learning in this domain involves an increasing internalization or commitment to feelings expressed as emotions, interests, beliefs, attitudes, values, and appreciations. Although nurses recognize the need for individuals to learn in the affective domain, constructs such as a person's attitudes, beliefs, and values cannot be directly observed, but can only be inferred from words and actions. Nurse educators like us tend to be less confident and more challenged in writing behavioral objectives for the affective domain. This is because it is difficult to develop easily measurable objectives and evaluate learning outcomes based on inferences of someone's observed behavior. Let's take a look at the levels under the affective domain. The lowest level is the receiving. This is the willingness to receive or attend to particular phenomena or stimuli. The words being used for receiving are the following: acknowledge, ask, attend, choose, describe, follow, give, hold, identify, listen, locate, name, and of course, receive. I will give you 5 seconds to read these words again. Let's go to the next slide. The second level is responding. This is when the learners are sufficiently motivated, not just be willing to attend, but is actively attending. So the words being used, or the verbs rather being used for this type of level are the following: agree to answer, ask, assist, communicate, comply, consent, conform, contribute, cooperate. I will give you another 5 seconds to skim through the words again. Let's go to the next slide. The third level is valuing. This is when behavior is motivated not by the desire to comply or obey or conform, but by the individual's commitment to underlying value guiding their behavior. So the example verbs here are the following: accept, adopt, approve, complete, choose, commit, describe, desire, differentiate, display, and endorse. I will give you 5 seconds to read these words again. All right, next. The fourth level in the affective domain is organization. The individual sees how the value relates to those already held or to new ones that are coming to be held. The following verbs are being used for organization: adapt, adhere, alter, arrange, categorize, classify, combine, compare, complete, defend, explain. I will give you 5 seconds to read these words again. Okay, next. The last level is the characterization. This is the internalization of values in which they have a place in the individual's value hierarchy. The following verbs are being used for this level: act, advocate, behave, characterize, conform, continue, defend, devote, disclose, discriminate, display, endure. Now, you might have noticed that a lot of verbs are repetitive. in the levels that are under the affective domain. What is important to note here, class, is that they are used dependently or depending rather on the content of the objective. Okay, let's proceed to the next slide. The psychomotor domain is known as the skills domain. Learning in this domain involves acquiring fine and gross motor abilities such as walking, handwriting, manipulating equipment, or performing a procedure. To develop psychomotor skills, integration of both cognitive and affective learning is required. That is, you need to use both your head and your heart. Now, the affective component recognizes the value of the skill being learned. This is when you actually understand the rationale of the procedure or each step that you're doing for a certain type of procedure. The cognitive component relates to knowing the principles behind each procedure, the relationships, why the procedure is being done for a specific type of case, and the processes involved in the skill. Although all three domains are involved in demonstrating a psychomotor competency, the psychomotor domain can be examined separately and requires different teaching approaches and evaluation strategies. In this lecture, we are going to discuss about Dave's level of psychomotor learning. Let's begin with the first level, imitation. This includes repeating an act that has been demonstrated or explained and involves trial and error. Now, class, you may have already experienced having your return demonstrations. This is an example of your imitation. Some verbs being used for this level are the following: begin, assemble, attempt, carry out, copy, calibrate, construct, dissect, duplicate, follow, mimic, and move. Okay, so familiarize these words again in 5 seconds. All right, let's go to the next one. So during return demonstrations, you were just able to use equipment which may have been just for practice, like things at home or your dummies at the skills lab. Now for this level, manipulation, this is the time when you go on duty at the hospital and you start to actually use the equipment that are being employed for nursing care. Manipulation, it continues to practice a particular skill or sequence until it becomes habitual. Now, some of the verbs being used are the following: acquire, assemble, complete, execute, improve, maintain, make, manipulate, operate, pace, perform, and produce. So one of the best examples here is performing your vital signs taking to your patient every 4 hours. So this becomes habitual. So 5 seconds to read through the words here. All right, next. The next level is precision. This happens when the skill has been attained. This usually is achieved when you are already working as a registered nurse in the hospital, because you'll be doing the same procedures or similar procedures in many situations or settings over and over again. Now, the verbs being used here are the following: achieve, accomplish, advance, automatize, exceed, excel, master, reach, refine, succeed, and surpass. So 5 seconds for you to read through these words again. All right, next. For this level, articulation, the skills are so well developed that the individual can modify movement patterns to meet a problem situation. Now, this usually occurs when you have become quite specialized in your specific station or department in the hospital. So even if rather a particular procedure is being done at the ward, but since you're in a specific department, such as um, in the ICU, you will have to learn how to modify some procedures to be able to specifically cater to your ICU patient. Now here, the verbs being used are adapt, alter, change, excel, rearrange, reorganize, revise, surpass, and transcend. I'll give you 5 seconds to read them again. All right. Now for naturalization, this is time when the individual begins to experiment, creating new motor acts out of your abilities. This is basically the expert level of being a nurse, right? So the following verbs are being used for this type of level: arrange, combine, compose, construct, create, design, refine, originate, and transcend. So most of our nursing theorists have already achieved naturalization, right? Let's go to the next slide after 5 seconds. Okay, so if you're done, let's go to the next part. So let's take a look at an example of a clear objective. Let us examine this one. Please read with me. At the end of 8 hours, given holistic post-operative nursing care, the post-cesarean section patient will be able to report a decrease in the pain scale rating and exhibit vital signs within normal range. First question. Is this specific? Well, yes. We definitely know what the nurse wants to do for the patient. Is this measurable? Yes. The nurse can assess the pain scale and vital signs of the patient if it is within normal range, right? Another example, or question rather, is this attainable? Well, yes. The nurse is equipped with holistic nursing skills for the post-operative patient. Is this relevant? Well, yes. The nurse's goal is to care for a specific type of patient with very specific nursing care needs. Is this timely? Well, yes. The nurse mentioned caring for the patient during her 8-hour shift. So, that was all about the SMART, making your objective SMART. Now, our objectives, following the ABCD rule. Let's check. Who is the audience? Well, it's the post-cesarean section patient. What's the behavior? To report a decrease in the pain scale rating and exhibit vital signs. What's the condition? Given holistic post-operative nursing care. And what's the degree? Within normal range. Okay, so did you understand how to write a clear objective now? Hopefully, yes. Let's go to our next topic. A teaching plan is a blueprint to achieve the goal and the objectives that have been developed, along with listing the goals and objectives. This plan should indicate the purpose, content, methods, tools, timing, and even the evaluation of instruction. The teaching plan should clearly and concisely identify the order of these various parts of the education process. Let's go to the next slide. Teaching plans are created for 3 major reasons. First, to direct the teacher to look at the relationship between each of the steps of the teaching process to make sure that there is a logical approach to teaching. Next, to communicate in writing exactly what is being taught, how it is being taught and evaluated, and the time allotted to meet each of the behavioral objectives. This is essential for the involvement of the patient and each member of the healthcare team. And finally, to legally document that an individual plan for each learner is in place and is being properly implemented. Okay, let's go to the next slide. A teaching plan should incorporate the following 8 basic elements. First, purpose, the why of the educational session. Statement, the statement of the goal or the overall goal. List of objectives. An outline of the content to be covered in the teaching session. The instructional method or methods used for teaching the related content. The time allotted for the teaching of each objective. The instructional resources like materials, tools, and equipment needed for us to achieve the objective. And lastly, the method or methods used to evaluate learning. Now, when constructing a teaching plan, the educator must be certain that, above all else, internal consistency exists within the plan. Let me show you a sample teaching plan. So here we have all the 8 elements discussed in the previous slide. So a teaching plan is said to be internally consistent when all the 8 parts here are related to one another. I'll give you 5 seconds to look at our sample teaching plan again. Okay, next. Now, the concept of learning contracts is an increasingly popular approach to teaching and can be implemented with any individual learner or group of learners. Learning contracts are based on the principle of the learners being active partners in the teaching learning system rather than passive recipients of whatever it is that the teacher thinks is good for them. It is about their ownership of the process. So I believe you have already signed your learning contract and uploaded them here in your virtual classroom. Now, a learning contract is defined as a written, formal, or verbal, informal agreement between the teacher and the learner that specifies teaching and learning activities that are to occur within a certain time frame. A learning contract is a mutually negotiated agreement, usually in the form of a written document drawn up together by the teacher and the learner that outlines what the learner will learn, what resources will be needed, how learning will be achieved, and within what time period, and which criteria will be used for measuring the success of the experience. So I think these have been presented to you during your orientation day in the beginning of this quarter or semester. All right? So here are the components of the learning contract. Content. This specifies the precise behavioral objectives to be achieved. Performance expectations. This will specify the conditions under which learning activities will be facilitated, such as instructional strategies and resources. Evaluation. This specifies the criteria to evaluate or use to evaluate achievement of objectives such as skills checklists, your care standards, or protocols and agency policies and procedures of care that identify the levels of competency expected of the learner. And finally, time frame. This specifies the length of time needed for successful completion of your objectives. These are the components of your learning contract. Again, the first one is your content, your performance expectations, evaluation, and time frame. And this ends our discussion on how to develop a health education plan. Thank you for learning with me today, class. To God be the glory. For questions, kindly type them in the discussion forum Q&A found in your virtual classroom for this week, and your moderators will answer them accordingly. These are our references for this week's topic. Thank you so much, class, for taking the time to finish this video. May you have a blessed week ahead. Bye!